Welcome to our continuing 2020 educational webinar series. I am Catherine Short, Partnership Marketing Manager for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business. A hospital, hospital network, healthcare practice of any size, billing company, or skilled nursing facility, and we manage every aspect of a compliance program, and our training library provides hundreds of modules that are easy to assign and track. As part of our complimentary educational webinar series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. We are so pleased to have Lauren Russell, Counsel at Young Conaway Stargatt Taylor with us today. Lauren specializes in the representation of employers on a range of issues relating to compliance with local, state, and federal labor and employment laws and constitutional provisions. She provides compassionate and responsive counsel targeted at achieving client goals while minimizing cost and risk. Lauren emphasizes client counseling on issues ranging from wage and hour compliance to workplace training and investigations to effective employee terminations with the goal of avoiding litigation before it begins. Her counseling practice includes handbook revisions, effective policy implementation, and on-site training on legal compliance. Lauren has developed and conducts specialized in-house training for emerging legal issues related to discrimination, harassment, and workplace accommodations. A copy of the slides is available for download on the control panel. Feel free to submit questions into the question box on your control panel during the presentation. We will address questions at the conclusion of the presentation. Your PAYCOM and PMI CEU certificates will be emailed to you following the broadcast. Your PAYCOM certificate will come directly from PAYCOM, and your PMI certificate will come from our email. There is no need to request either one. Additional CEU opportunities will be available to BC Advantage members following the live broadcast. See their website for details. A download of the handout is available with a button on the bottom right-hand side of your screen. So welcome, Lauren. Thank you for being here.
Thank you very, very much. Excuse me. I am thrilled to be here. I'm thrilled to talk about the definition of emerging issues, right? We are learning in a way that we never knew we could about how to adapt to, what I suspect for my career is going to be really, sort of a unique and defining moment. And I think that that's true for most of the clients that we are talking about as well. We're really being tested in our adaptability these days. And so while that is a wonderful challenge and learning experience for all of us, it can also be really intensely stressful. And I'm hoping that we can work through these issues together today so that everybody leaves the webinar feeling, like they've got at least a roadmap. I do want to emphasize that every business is different. And I think that's one of the things that makes counseling about, this reopening process that we're going through really difficult. Hopefully, as I talk, we're going to see that these topics apply in very similar ways to businesses that have been completely shut down and are just starting the reopening process, and also businesses, and I suspect this is most of the healthcare industry, that have been operating through the pandemic, but you've been operating at decreased capacity. Only truly emergency matters, for example. I know that a lot of my clients who are sort of in the dental field, in dermatology, and in some of the other lines of healthcare that has perhaps more of a cosmetic wing, that they have shut down things like routine hygiene and annual checkups. I know that's true for a lot of OBGYN practices, and are really just focusing on people who have dental emergencies. pregnant patients for OBGYN practices, things like that. Certainly for surgical practices, elective surgeries are being put off. But we're going to find that as we start reincorporating a lot of those quote unquote elective procedures, that we're going to be facing the exact same problems. So what are we talking about here today? We're going to start with, the process of recalling employees. Do we really need to? How are we going to manage that? How are we going to make these decisions? Once we have started recalling, how are we going to recall staff? If our business doesn't fully resume and we need to maintain people on furlough or reduce the workforce, how do we accomplish that? And as we're doing all of this, how do we incorporate these new types of leave? There are really 4 categories of leave that we're going to be talking about, and how do we manage that process? Then we will talk about managing unemployment. This is probably, of the calls that I'm getting from my clients, at least 50% of them involve questions about the ability to recall employees from unemployment and employee unwillingness to return to work. So that's been a major issue I'm seeing. And then last but not least, addressing workplace safety concerns. This is sort of last on our to-do list because I think that it is consuming a tremendous amount of mental energy for employers. But hopefully by the time we're done talking about it, you're going to realize it doesn't need to consume that much. People are very, very worried about the legal exposure from employees getting sick on site when they are recalled to work. And while we can't stop employees from filing lawsuits, I think we are going to see, as this situation progresses, that employees are experiencing very little success with these types of lawsuits. So we're going to talk about mitigating the risk there, of course, but the reason that it's sort of last is that I don't think that there's all that much that you're going to need to do that you aren't already doing. So hopefully good news on that front. All right, so when we are talking about recall, as I said, the considerations are going to be very similar, whether we are returning from a complete closure, whether we are ramping up from partial closure to a more fulsome practice, whether we are in full operations and everybody's been working remotely and you're just going to move them back to the work site. The leave issues certainly are going to be identical for all of these groups. When we talk about who needs to be in the office and who needs to be out of the office and things like that, again, similar concerns. So hopefully this will be useful and insightful to all listeners, regardless of sort of the stage that your business is in. All right, so let's start with, when I say recalling, it can mean 2 things that I sort of hinted at with the last slide. One is that everybody has been out of work, either unemployed or on furlough, and we are bringing them back to an active work status. Or, and this is many, many businesses across the country, everybody is working remotely and we are starting to recall employees to the office. Let's focus for a minute on sort of the in-office versus out-of-office process. The very first question that we need to ask is, it's sort of a 2-part question. Who do we need to ensure business continuity right now? And where do they need to be located? And this is a struggle that I really have with my clients. Not all of them, but many of them feel very strongly that they want people on site. And it is lovely if you can do your job remotely, but the reality is I like it better when I can look you in the face. I know exactly where you are at any time of the day. It is easier for me to monitor and supervise your productivity. But that demand comes with risk right now. And we need to think critically, and with a more open mind about whether employees who can work remotely really need to be in the office. So let's talk about your receptionist, for example, in a small medical practice. This person serves some important functions as the face of your business. They greet patients. They are, really in a lot of ways sort of an ambassador for your business. And I know with the small medical practices I've seen in the course of my life, sometimes you have a deeper relationship with the front desk staff than you do with your doctor. You certainly spend more time chatting with them. You're scheduling. They're calling you for reminders. You're calling them to reschedule, and then having a quick chat while you're in the waiting room, for example. That is an important function, but is it a function that your business actually needs right now? A lot of practices are not even allowing people into a waiting room. So what happens is you pull up in the parking lot and you call, and they say, okay, well, the doctor's ready for you. Please come in through the doors, proceed directly to exam room 2. Do not stop in the waiting area. If that's the case, your secretary can do that from home, right? And if you don't have software or a phone system that allows you to reroute calls to somebody's cell phone, I would strongly suggest in the current environment that you invest in that. So again, even when this is an individual who really had a large role in face-to-face communications, their job may be more appropriately done from home right now. So keep in mind that for many of the states that are reopening right now, guidelines encourage continued remote work, and that we need to comply with those guidelines to the extent possible, particularly where we're talking about high-risk populations, individuals in that 60 to 65 age range and older, individuals who have chronic health conditions, individuals with obesity, heart problems, diabetes, right? I am rattling off a list from the CDC's website. Everybody listening to this knows vastly more than I do about, these high-risk categories. But the reality is that if your, front desk staff, if your records clerks fall into those categories, and there is a way, with electronic medical records for them to do that work from home, you really need to strongly consider it, even if you are more comfortable having people in the office. We need to keep all of this in mind in terms of whether we're conducting a partial or complete return to work. So clinical staff need to be, by and large, in the office, right? Unless you are doing telehealth consults. You need to be able to, feel my glands or, examine the color of my skin and see, be able to push on my fingernails if there are questions about, my blood, my circulation. So the reality is that there are some jobs that you absolutely have to be physically present for. But again, a lot of the clerical staff can oftentimes stay off-site, and we need to think about that. One of the things that we are seeing is that, we've got 2 months under our belts right now. Are there positions that really, as I was talking about, can sort of be moved to a remote work environment on an indefinite basis? I sort of referenced that productivity has been a major concern for a lot of clients under these circumstances. And we need to think critically about how to manage these issues remotely. Very large corporations have been dealing with these kinds of problems for a long, long time because flexibility and remote work has been a popular perk for large organizations for a long time. It helps reduce overhead. So what does it mean from a management perspective? There is going to be more frequent check-in. You are going to have to establish some new expectations and really help employees understand that If they want the perk of working remotely, and it's a perk but also a safety issue right now, then we're going to have to find ways to do that effectively. And I think that as child care facilities reopen and those options become more available, we are going to see an increase in employees' abilities to sort of work from home in a more dedicated capacity. One of the last considerations we need to take into account, and we're going to talk about this a little bit in more detail when we talk about leave, is that high-risk employees in a lot of states are sort of mandated to continue working remotely. That is true here in Delaware, where I am located. While we are beginning to reopen businesses effective June 1st, the most recent guidance that I have seen from our governor says, even though we are reopening, we are doing it under a lot of limitations. And one of those limitations is that high-risk workers really need to continue to stay out of the office. And so we need to think about rejiggering some of our job duties, right? If you have high-risk employees who have a mix of duties that can be done in the office and outside of the office, can we transition more of their work to outside of the office? Can we reassign their office duties to somebody who's going to be in the office anyway, and manage it that way? So these are all considerations that we need to think about. And it may be that for the success of the business, that we do restructure some jobs for the intermediate period, right? The next, let's say, 6 to 12 months. Hopefully it won't be that long, but we're hearing from a lot of experts that we may see another spike in coronavirus cases coming in the fall. And so we should take this summer period, this reopening period, to really get our feet under ourselves and think about, if this happens again in 3 months, what are we going to do? How are we going to manage that so that we can ensure continuity and protect the most vulnerable employees? All right. So once we've sort of decided what our needs are and, how job duties can be divided, how are we going to return? Are we doing all employees all at the same time? That may be necessary depending on the nature of your business. Hospitals, right, they never came away from all employees all the time, really. But again, think of different divisions of your business in different ways. So clinical staff have been in hospitals the entire time, but maybe billing and collections and insurance and all of that stuff, maybe they have moved to more remote work. I don't know. If you have a sort of a private practice scenario, are we returning all employees to work but on rotating schedules? This is what my office has elected to do, that they are splitting all of our staff 50-50. And everybody's going to be working an A-B schedule. So we'll all work 100% of the time, but Group A will be in the office Monday, Wednesday, Friday, and Group B will be there Tuesday, Thursday. Following week, we switch. And so people get some of the productivity and the convenience of being in the office, but it allows us to draw down the number of people so that we can more easily maintain social distancing and things like that. So that is one option. Then, last option is, do we not rotate? Do we just identify who is completely essential and only return those individuals? If your practice has taken a hit, if clients, patients are nervous about coming back for routine treatments, dental hygiene, your annual dermatology appointment, your annual OBGYN appointment. If people want to put that off, you may not need 100% of your staffing levels. It may be that if you had, and I talk a lot about dental offices because I represent a lot of dental offices, but if you have 10 hygienists, and you only need 5 of them, are you going to recall all 10 on a part-time basis? Are you going to only recall 5 of them on a full-time basis? There are benefits and drawbacks to both approaches. And, you want to think critically about how you're going to manage that. Because there's especially when there's a reduction in hours, employees continue to be eligible for unemployment. And so there's just a management burden to having to report to the Department of Unemployment Insurance. That's what they're called here in Delaware. Whatever division of your state manages unemployment. You're going to have to send in reports every week for the following 45 employees worked this schedule, and this is a reduction from what their normal full-time schedule is, so that the Department of Unemployment Insurance can then calculate what their benefits allocation is. And so from an administrative perspective, oftentimes it's easier to leave, 50% of your staff fully furloughed and 50% of your staff recalled to full-time work, just so that you're not having to make those weekly reports. But again, there are drawbacks to that, and trying to distinguish who stays on furlough and who does not is very difficult. So when everybody returns, there are very few worries, right? You cannot accuse somebody of discrimination when the entire practice was shut down, 100% of people were laid off. Now the entire practice is up and running, 100% of people have been recalled on the same terms and conditions. In terms of discrimination claims, very little risk here. We have the same situation when we're doing partial returns, all employees in a single job classification, for example. So we are not recalling any of our cleaning staff because we've outsourced all of that, but we are recalling 100% of our clinical staff. Again, easy peasy, because there's a very clear delineation. Anybody with this job title gets recalled. Anybody with that job title does not get recalled. When we are picking and choosing, going back to our 10 hygienist situation, we only have 50% of our hygiene work that has returned. So we have 50% of the hours available. If we recall only 5 of our 10 hygienists, and we do it on a full-time basis, that can create risk, because how do we pick those 5 individuals, right? If we say, well, we want these 5 people because they don't have children, so they're going to be more reliable, that's discrimination. We want these 5 people because they're young and healthy, and we don't think they're going to need leave during this crazy time we've got. That's discrimination, right? One of the ways that you can deal with this risk, and that I like very much, is ask for volunteers first, right? If you have 10 hygienists and you only need 5 people, reach out and with a letter saying we are beginning to recall people. We do not currently have a full volume of hygienic appointments, and so we are reaching out to all of you to find out who wants to return first. If we have more volunteers than we need, then we will come up with a methodology to allocate the work. If we have fewer volunteers than we need, we may recall you, involuntarily, but we really want to start with those people who are looking to return to the office first. You will get some volunteers. My experience has been with my clients that they are getting fewer volunteers than they need. People have been surprised by how many individuals out there want to return to more normal, level of interaction and getting out of the house and accomplishing the daily life activities that we do. But the nice thing about asking for volunteers is nobody can accuse you of discrimination. We took everybody who asked, right? Do be clear in these situations. If you are recalling only 50% of your staff because you have only 50% of the volume of your business, then, in hopes that it'll pick up again in the fall, that's great. But what if it doesn't pick up again in the fall, right? What if you stay at 50% of your business and we just see, a 6 or 8 month reduction in the volume of services that are being provided. What are we going to do to those people who did not volunteer to come back? Usually what we say is, we will reach out to the rest of you as business picks up. But of course, we don't make any guarantees. So just be very clear with them, because a lot of people are sort of going to assume, like, of course the business is going to bounce back 100%, and it'll look exactly like it did before, the coronavirus at some point in the near future. We just don't know that that's going to be the case yet. We don't have enough experience to say whether that's going to happen or not. So, let's sort of put a pin in that and make sure that employees have realistic expectations. We also want to be clear about whether furlough benefits are going to be lost. So a lot of medical practices furloughed their employees, which means that you remain on the payroll, but you're not getting paid, right? So it's a long-term unpaid leave. Many businesses elected to pay some amount of their employees' salary or hourly wages to help them get by. Many businesses elected to cover the full cost of health insurance for their employees while they were on furlough. If you're going to change that practice as you start recalling employees, let them know up front so that they can decide whether to volunteer. You've got to give them full information so that they can make an accurate determination. So let's talk about our last option, which is partial returns we pick, right? So we are going to select who it is that we want to return to work. Tom, Dick, and Harry, you are coming back. Sally, Sue, and May, we don't want you. Off you go. This is a risky approach, and we need to think really carefully about the way that we are going to do that to avoid bias claims. So when we pick, the very first thing we need to do is identify super clear criteria for who is coming back. I have a lot of clients in the retail industry who are doing this based on sales metrics. So we are bringing back our best sales employees first because they make us the most money, and that allows us to sustain the pieces of our operation that are non-revenue generating. We have sort of a different structure in the medical field, right? So oftentimes, that's not going to be an effective way to look at it. But if you have productivity metrics, whether it's about revenue generation or some other type of productivity, that is absolutely a valid way to make the determination. You can do it seniority based. So we are going to recall the longest serving employees first. You've got to define how you're judging seniority, right? If you don't have a unionized workforce, you probably don't have a very clear seniority process in place. But is it seniority with the employer? If you've had a break in service, so what if I left for a year and a half because I wanted to be a stay-at-home parent, and then I decided, no, I do want to go back to work. Staying at home is not for me, and I rejoined the business. Do I subtract that 1.5 years from my total years of service? Did I start over when I came back? And so all of the years I served before that 18-month leave don't count at all. Are you doing seniority in the job position, right? So I have been with the company for 25 years, but I've only been a billing clerk for 6 months, and you want to recall the most experienced billing clerk or the most experienced filing clerk, or what have you. Take your pick. You just need to think critically about, is service to the overall organization what we care about? Is service in a specific job what we care about? These things matter, and they bear consideration. And then once you have those criteria, write them down somewhere. And there's no wiggle room, right? People get into a tremendous amount of trouble when we say, okay, here are our criteria, and then you get to a specific department where you've been having trouble. And you think, who's the troublemaker in this department? Bob. Bob's the worst. He's been here forever, but he is a cancer in our organization. Have we disciplined him? No, because he's just got a bad attitude. He's miserable to be around. And so we skip over Bob, right? If we deviate from our policies and practices because Bob is a miserable human being and Sue is a joy. She is a love. Everybody is happier when Sue is around. Yes, she's only been with the organization for 12 months, but she has busted her behind and she has worked really hard. You're recalling individuals in every other department on the basis of seniority and performance metrics. And Bob and Sue are, being picked because I like one and I don't like the other. You expose yourself to tremendous risk of discrimination claims there. So figure out the metrics, write them down, and stick to them. A lot of clients use as sort of a last distinguishing factor disciplinary history. Again, think critically about what discipline matters to you right now. Anybody who's on a final written warning, anybody who's had performance evaluations that are below meets expectations, those kinds of things. Is that super important? Does it outweigh performance metrics? Do we care a lot about attendance right now? Probably yes. If you only have 50% of your staff in the office, it's that much more important that everybody shows up on a given day. What about policy and safety violations? We want people who are going to follow the rules, wash their hands, socially isolate at home. All of these things are really important. Depending on the size of your organization, you may want to conduct statistical analysis. If your organization is not enormous, if you are not, of a size where statistical analysis of your employee population is useful, then still take a look at your recall pool. Are we recalling every single woman in a department and, there are only 2 men and we're not recalling either one of them? Is there, a racial slant here? Is there an age or disability slant here? I know that it is not your intention to discriminate, but when there is a statistical bias in the recall pool, you can still be sued for discrimination, even if there is a neutral policy being applied. So this is a really important part of the process. It's aggravating because we don't like to think that any of those considerations weigh in at any stage, but you do need to take the step. When we are talking about furloughs and reductions in force, when we don't need to recall the entire workforce, we're looking at the same exact considerations as we were before, right? If we are furloughing or ripping all employees or broad classifications, again, we don't have big concerns. If you have decided to dump your entire billing department and outsource that, you're not going to have discrimination problems. PR problems maybe, but no discrimination issues. Again, it's when we're selecting members from within a job category to terminate that we have issues. Once again, as with when we are, returning the entire workforce from a complete shutdown, let's start with volunteers. We have concerns when we are picking some people and not picking others. Once again, statistical analysis may be a benefit. So if we are recalling only 50% of a category of LPNs, licensed practical nurses, we realize there's going to be a major change in the volume of work we have, so we've decided to reduce 250. So instead of just recalling people on sort of a rolling basis, we're saying this is going to be a permanent change in our business structure. We are terminating the employment relationship with 250 individuals, and we're doing it based on performance evaluations. So the top 250 will be recalled, and the bottom 250 are going to be unemployed, with respect to our organization permanently going forward. We need to look at what those numbers show. Is there a statistical bias on the basis of race, sex, age, disability, any other protected category? But we need to really, think critically about those issues, and understand that there can actually be bias in the underlying data. So you look at this pool and you think, we are using the most objective criteria we have, performance evaluations. It's we give a number ranking. So all of the 1s and 2s are going to be laid off. All of the 3s, 4s, and 5s are going to stay with us. Super easy, super objective, right? The individuals who are conducting those performance evaluations may have latent bias. And so they may be making biased decisions. And you need to consider that and make sure that you are accounting for that reality when you are making these reduction decisions. Okay, so how do we deal with the leave issues that come along? You're recalled, but I can't come back, right? This particularly becomes an issue when we are doing involuntary recalls. So we're not asking for volunteers anymore. We are saying all LPNs must return effective June 8th, 2020. How do we handle that? First, if you are recalling individuals other than full scale, so if you are going to start by recalling 50% of your LPNs, and then you'll recall the other 50% when you need them, you may not take into consideration what their leave needs may be. So remember, we said we're going to come up with these objective criteria, seniority or performance or whatever the case may be, and we're going to follow that list. And it doesn't matter if you know that Sue has 3 small children and she doesn't have childcare, and so there's no way she can come back to work. If she is your number 2 employee and she is the next person on the list, you need to recall Sue. And then you let her say to you, I'm so sorry, I have children at home, they're not in school, I have no childcare options, I need leave. That's fine. We're going to process that next, but we're talking about how do we make the decision itself, and the decision itself needs to be blind to the leave requirements. This is a really hard thing to do because when you are recalled, some of the types of leave are unpaid. Or if you're taking childcare leave, for example, under the expanded FMLA provisions, you're only getting 2/3 of your income. And with the current unemployment situation, here in the state of Delaware, the maximum weekly wage is $400. And then you get a $600 federal bump per week. So you can earn up to $4,000 a month on unemployment right now. A lot of employees are making more on unemployment because of that $600 bump than they would when they go back to work. And especially if you're recalled and then you're immediately placed on leave where you're only getting 2/3 of your income, it feels like a real kick in the teeth. And a lot of employers are saying, well, that's not fair. I shouldn't have to recall these people. They're making more on unemployment. They've got to support young children. We shouldn't recall them. We should just skip over them in the line and go to the next person. That is a very, very risky thing to do because you're doing it from the goodness of your heart, but it can look like anti-parent bias. It can look like bias against elderly and disabled employees. And the reality is that while the employee may be thrilled right now for that opportunity, that $600 bump is supposed to expire on June 31st, I believe. And so effective August 1st, they're going to be making way less money on unemployment. It's going to be a really crummy situation for them financially. What if your business doesn't bounce back? What if you leave all of those individuals on furlough and then you have to risk an entire pool of people that is packed to the gills with individuals who are disabled, over 65, or have children, right? That is going to be a huge liability for you. What if the employee just gets pissed off? What if you give a retention bonus to all the people who came back, right? Hazard pay. We're going to give all of you $1,000 next month because you showed up and you did the thing. if I'm on unemployment, I'm missing out on that $1,000 and I'm pissed, right? Well-intentioned discrimination is still against the law, and if the employee changes their mind down the road, even if they agreed up front, you will be on the hook. So do not consider these factors when you're engaging in your recall. It is better to recall everybody and then transition people to some of these federally protected leave programs than it is to leave them on unemployment and risk any of the outcomes that I sort of outlined there. All right. So we recall everybody. As employees request leave, we move them to one of these leave programs, and then you move to the next person in the recall list. That is our protocol. There are 3 types of leave that we really need to focus on right now. There is the Emergency Paid Sick Leave Act and the Expanded Family and Medical Leave Act. Those are part of what we call the FFCRA. That was the first Coronavirus Relief Act. Family's first Coronavirus Relief Act, I think, is FFCRA, although I could be misremembering that. Then we've got our old friends, the Americans with Disabilities Act and the Family and Medical Leave Act. Virtually every state in the union has a parallel state law to the ADA. Some have parallel FMLA provisions, and you need to be very alert to those. States like New York, New Jersey, here in Delaware, we do not, but you need to know your local laws and make sure that you're thinking about all of these things. So, FFCRA leave. This is an incredibly complex web, by the way, and so it's really important to make sure that you are talking to counsel, that you are reading the U.S. Department of Labor's guidelines. Those guidelines, by the way, are being changed very frequently, so you want to check them regularly. But here's the general rule. You can take emergency paid sick leave and EFMLA really for only one reason, which is caring for a child whose school or place of care is closed due to COVID-19. And you get 2/3 of your regular rate of pay for that leave. It is up to 2 weeks of EFMLA and then 2 weeks of EPSL and 12 additional weeks of EFMLA. Those can be blended together in order to provide 12 weeks of paid leave, or they can be taken separately, in which case you get 2 weeks of unpaid leave and 12 weeks of paid leave. And that is something that you need to think very critically about and then talk to employees about, because employees right now are expecting that they get 12 weeks of paid EFMLA, and that's not necessarily true depending on how you structure your leave program. So very, very important there. EPSL, the Emergency Paid Sick Leave Act, has 5 additional categories for which you can take leave. If you are subject to a quarantine or isolation order, if you have been advised to self-quarantine, or if you are experiencing symptoms and seeking a medical diagnosis. So the things that directly impact the employee, you get 100% of your regular rate of pay. Remember, it is only 2 weeks of leave up to a maximum of 80 hours, and there are financial caps as well. Then you can take 2 weeks up to 80 hours at 2/3 your regular rate of pay for childcare, which we already talked about. If you are caring for an individual who meets any of those first 3 categories, right? So I have a child who is subject to a quarantine order or has been advised to self-quarantine or is experiencing COVID-19 symptoms. I have a spouse who falls into one of those categories. So caring for another gets me there. And then there's this catch-all category, substantially similar conditions specified by the U.S. Department of Health and Human Services. We don't have any definition for that yet, so we can sort of ignore it. But those are your qualifying reasons. And that's it. You get 1 crack at this leave, by which I mean it is 80 hours total. If I get COVID and I take my 80 hours, and then my husband gets COVID and I want to take 80 hours to care for him, the answer is no. I have exhausted my 80 hours of EPSL. I can take leave under a different protection program. I could take traditional FMLA perhaps, but I cannot take two sets of 80 hours of leave. So who's covered by these new FFCRA provisions? Private sector employers with fewer than 500 employees, pretty much all public sector employers. So if you are a public health provider, then you're subject to that, even if you're huge, generally speaking. 2 weeks of leave, up to 80 hours. For part-time employees, the leave is prorated. So if I work 20 hours per week, I will only get 40 hours of EPSL leave. When we're talking about what is your regular rate of pay, it is your salary or your hourly rate, and it includes adjustments such as commission or overtime. So if you have employees with variable rates of pay because of overtime, commission, other things like that, you're going to be doing a look back. And the U.S. Department of Labor has lots and lots of regulations on how to do that. So you need to make sure that you are looking at it. It's not just, oh, what did they make the week before COVID hit and everything shut down? That's not the way we're doing this. All right, EFMLA, it's the same group of businesses, private sector employers with fewer than 500 employees, all public sector employers. I should note that for both types of FFCRA leave, there is a small business exception if you have under 50 employees, but we are being instructed by the U.S. Department of Labor to invoke that exception sparingly, and that you should work collaboratively with employees to give them whatever leave you can give them, even if it is not the full entitlement under the FFCRA. So if you have 49 employees, the answer is not, oh, that doesn't apply to us, moving on, right? The answer is, should we really be asking for this exception? How are we going to justify that we need this exception? We're probably going to get sued by employees for denying their request for leave. So we're going to have to think about how will we justify this to a jury or to a judge. So be aware of that. Okay, again, EFMLA, it's 12 weeks of leave on your regular leave schedule. So in the same way that EPSL is quote unquote prorated, if I was working 20 hours per week before the coronavirus hit, and you're now recalling me and I say, no, I need the 12 weeks of EFMLA, I only get 20 hours per week at 2/3 my regular rate of pay. I don't get 100, I don't get 40 hours per week, 100% of a full-time schedule. I get what my traditional schedule was. 2 weeks of unpaid leave, and then 10 weeks at 2/3 of your regular rate of pay. Same calculation rules when we're talking about regular rate of pay. Again, as I mentioned, the first 2 weeks of EFMLA are unpaid. With an employee's consent, you can run those first 2 weeks of unpaid leave concurrent with an employee's EPSL entitlement. But you cannot require right now, and this changes day to day, so check again. But as of this specific moment, you cannot require employees to run their EPSL and EFMLA concurrently. So it is possible that an employee says, no, I want to save my EPSL, and I only want to take 12 weeks of EFMLA. I'll take my 2 weeks unpaid and my 10 weeks paid. Remember that the pay is for childcare obligations only. Traditional provisions of FMLA are unpaid. When is childcare leave actually necessary? The guidelines tell us that an employee needs to provide the name of the child and the name of the school or care provider that has closed, and they have to provide you a statement that no other suitable person is available to care for the child. This includes the other parent, relatives, babysitters. I am advising my clients to keep an ear to the ground, know what's going on out there in terms of, are child care facilities open? The regulations also note that if you want that payroll tax credit, that sweet dollar for dollar payroll tax credit, you have got to have adequate documentation for the IRS. What we are hearing is that for a closed school or daycare provider, an email or a public notification about the shutdown of public schools will generally be sufficient in concert with that employee's written statement that there is no other suitable care available. All right. The ADA, our old friend. the most prevalent issues we're seeing right now with the ADA are denials of reasonable accommodation requests. So the ADA requires that employers provide reasonable accommodations that would permit a qualified employee to perform the essential functions of the job. An indefinite period of leave is not a reasonable accommodation, but remote work, isolation in the workplace, those are very common accommodation requests. They have been my entire career, and we are seeing an increase in those requests. And you need to really, if your entire workforce has been working remotely, you're going to have a hard time justifying why it is that employees cannot work remotely now if they are disabled. So again, think about whether there is a way to restructure some of your work and create more of these opportunities, particularly if you have a fair number of high-risk individuals in your workforce. The EEOC is indicating that accommodations can also include adjustments to safety protocols, including PPE requirements. If you require N95 masks in your workplace, and employees are telling you that the N95 masks cause them to overheat or otherwise exacerbate some underlying physical health condition that they have, then you need to think about whether you can relax that requirement. If the requirement is there for employee safety, we may be more willing to relax it than if it is there for patient safety. But you're going to have to think about it. You're going to have to be able to justify it. It can also include things like adjusted work schedules, letting employees come in early or come in really late. So working off hours so that they're in the office with fewer individuals, working weekends. And then it can also, as a last resort, include temporary reassignment to another position if there's something that meets their needs. Okay. One of the things that we also expect to see, in addition to a huge escalation in the remote work requests, is an increase in new, previously unidentified disabilities. We are hearing through the grapevine, I'm sure that you all are hearing more than I hear, given your line of work. We're hearing through the grapevine about an increased impact of the stress of this pandemic on individuals who had pre-existing depression, anxiety, PTSD, and OCD. And they may not have impacted the workplace before, right? If I was seeing a psychiatrist and had a good medication regime to manage my depression and anxiety, it's possible that nobody I worked with knew that I suffered from these issues. But the intense strain of the uncertainty of this pandemic has thrown a lot of people off of balance. And so it may be that I have a history of generalized anxiety or clinical depression or OCD or PTSD that I was managing very, very well, never impacted the workplace. And all of a sudden, I'm showing up and telling you, I am so anxious I cannot leave the house. Or my OCD is completely out of control. Whenever I leave the house, my compulsions just override me, and I cannot work in the office right now. Those are disabilities that we need to accommodate. And while we can ask for a doctor's note to get deeper understanding, we need to treat these things seriously and not assume that they are manufactured. On the other end of the spectrum, everybody is stressed out right now. Everybody is anxious about the situation, and generalized concerns without a diagnosis are generally not going to be considered a disability. Note that for known conditions, even when they're invisible, things that you knew about before the pandemic, we should not be asking for doctor's notes. Diabetes, asthma, chronic lung conditions, heart issues, people who are immunocompromised. If somebody took time off under the FMLA last year to undergo chemotherapy, now is not a great time to say, well, we need some evidence that you're immunocompromised, right? Again, you all know more about this than I do, but if we have some sense of what is in somebody's medical history because they have taken leave under the FMLA or they've asked for accommodations under the ADA. Be very careful about demanding doctor's notes at this point. Last but not least, we do have the FMLA. That's 12 weeks of unpaid leave with job protection. It runs concurrently with any other leave that would normally be available to an employee under your paid leave policies. Note that it is 12 weeks of leave total under the FMLA and the EFMLA. There are different qualifying requirements for the FMLA and the EFMLA, right? EFMLA is any business under 500. FMLA is only employers with 50 or more employees. So even though it's the same pool of leave, different employers may fall into these buckets. Make sure that you are thinking about whether an employee qualifies under both laws independently. Very, very important. The key FMLA protections we're going to be seeing right now are leave to care for a family member with a serious health condition and leave for the employee's own serious health condition that prevents him from performing the essential job duties. If I have a major health condition and my doctor says, it is simply unsafe for you to be in the workforce right now, you might fall into that second category. We're going to give them the FMLA paperwork and we're going to let their doctor tell us what it is that we need to know. All right. So again, FMLA could cover employees who are diagnosed with COVID-19 and are not recovered within 14 days, employees caring for family members with COVID-19 who don't recover within 14 days. Remember that 14 days is your EPSL coverage. Employees with serious health conditions who are physically capable of working, but jobs can't be done remotely, and employees residing with high-risk family members whose doctors have told them to shelter in place. I personally think this is a big stretch, but we need to provide employees with the FMLA paperwork, and we need to let their healthcare providers tell us whether they meet the criteria or not. Okay. Quickly, let's talk about managing unemployment. We are receiving, as I said, widespread reports of employee resistance to recall. It's because there's so much money available, right? $1,000 until July 31st, and you don't have to look for a job. This is, a pretty sweet spot to be sitting if you're an employee who does not want to work. So employees, generally speaking, who are recalled to work at pre-coronavirus rates, so same hours, same rate of pay, should not be eligible for unemployment. If the employee refuses to return to work because the unemployment benefits are so rich, you need to contact your State Department of Labor, tell them that you've got an employee who's declined to return without justification and that you would like the benefits to be terminated. The federal government is classifying this refusal to return because of a rich benefits package as fraud, and they are instructing states to prosecute. So you don't want to be participating in the shenanigans. Let the State Department of Labor know, and then turn it over to them. It's not your problem at that point. Okay. If the Department of Labor's, it is the Department of Labor's job to make that determination. I've got a lot of clients saying, I feel so guilty, right? I mean, I understand why they don't want to come back to work. That benefits package is really nice. You're not making the decision. You're giving the Department of Labor the information it needs to make the decision. It is that simple. Do not make promises to employees about whether they can get benefits, they can't get benefits, how much money are they going to get. If an employee relies on your statement and you are wrong and they give up a better benefit being employed with you, you can be sued for detrimental reliance. You do not want to be there. So make sure employees know that you're making no promises. This is the best information I have, but the only accurate information comes from the Department of Labor. Go talk to them. Okay, that being said, employees may continue to be eligible for benefits if they refuse to return to work because of unaddressed workplace safety concerns. So I'm telling you that you are not complying with the CDC guidelines and you're ignoring me, and I am nervous. If they are physically capable of working but can't perform their current job because of a high risk, because they're in a high risk pool. And if they refuse to return due to fear of infecting high risk household members. Some states are taking a very lenient stance on these issues, and really giving employees, a lot of leeway here. So don't assume that employees who are refusing to return are going to be bumped off of unemployment. Okay, last but not least, the thing I said you really didn't need to worry about that much, which is workplace safety concerns. Follow the guidance, right? Read it regularly. Make sure that you are up to speed on these things. Follow the information that is being shared by the AMA, by the ADA, whatever your sort of professional affinity groups are. Check in with them, see what they're doing. If you are doing what the state and federal government say you should, and what your affinity organizations say you should, if you're conducting medical screenings for employees, medical screenings of patients, if you're mandating the use of PPE, you should be fine. OSHA has been issuing a tremendous amount of industry-specific guidance. It is not binding, but it's really useful stuff. I know that they've got information out there on dental practices. I think the CDC put out guidance for pediatric practices, but it was really about diagnosing COVID in pediatric patients. But check up, make sure that they don't have, specific information for your organization or your niche practice, because they are releasing it very regularly, and that can be super helpful. Follow it. And then make sure that you are responding to employee concerns as they come up. No employee should feel like their concerns are being ignored, even if that employee is a colossal nuisance to you, right? Somebody in every office is going to be terrified, and they're going to ask why it is that you are not spraying disinfectant all over people through air vents in the ceiling every 15 minutes. And you're going to say, that sounds highly, unlikely to work and also dangerous to people. You still need to acknowledge the request and respond to it in a substantive way. Employees who feel like they're being ignored or marginalized are much more likely to sue you. Plus, it's nice to have a paper trail, right? This is a lawyer talking here. It's always great to have it written down that we heard your request. We are not complying with it for the following reasons. Thank you so much. We assure you that you are safe here. If you are following all of those guidelines, risks of a successful COVID-19 claim are slim. Risks of a successful negligence claim are slim. And I'm talking about employee claims here, not patient claims. And you'll be really well positioned to defend whistleblower claims if you have all of these protocols in place. That was a very swift and high-level summary, I guess, of what we're dealing with here. I'd be happy to field a couple of questions if we have time.
Sorry, I was muted there. Thank you so much, Lauren. I very, very much appreciate it. Sorry about that. Okay, so I do believe that we do have a few questions, and let me see what we have here. Okay, so some of my employees are refusing to wear masks. Can I force them to wear masks? What if they refuse? What do I do?
Yeah. I am getting a surprising number of these types of questions from clients.
Mm-hmm.
None in the medical field so far. But the answer is that by and large, yes, you can absolutely require employees to wear PPE, gloves, masks, gowns, whatever the case may be. There are a couple of exceptions. Religious exceptions may apply, although I'm not aware of any religion that dictates against the wearing of PPE. More frequently, it's a disability-related claim. So I have some sort of breathing problem, and N95 masks make it very difficult for me to get enough oxygen. We do have to evaluate those claims to see, is there an accommodation available? Is there a different type of mask you could wear? Can you work remotely? It may be that there is no way for that employee to do their job and to do it safely without PPE, in which case They are no longer a qualified individual capable of performing the essential functions of their job. They have no legal protection. You can terminate them. You could furlough them until the circumstances have changed. But by and large, in a normal situation, you can force employees to wear PPE. And I will note that political objections are absolutely not a valid basis to refuse to wear PPE right now.
Right, right. Okay, how about what do I do in case? Okay, so this is an interesting question. It had to do with
Mm-hmm.
recalling employees. What about if an
Mm-hmm.
employee is ghosting me? Should I
Uh,
amend the employee handbook right now before I start recalling people in to include a
mm-hmm.
policy for this? What should the procedure be for this? Should I
Mm-hmm.
call, leave a voicemail, text, send an email, certified letter? If there's no response, then let them go. What should we do?
Don't forget carrier pigeons and smoke signals. Very important, right?
Right, exactly. Everything.
um,
Do
yes.
it all.
Um, so I recommend that in the recall letter itself, that you give employees a deadline. And I've got quite a
Like an
few
actual
clients
letter,
who
or
are
are you
dealing with
saying
this.
an email or what? Like
It
when you say
depends on the way that your workforce is structured.
okay.
So one of my clients is very worried about its warehouse workers because a lot of them, they don't have company email addresses.
Oh yeah.
And a lot of them don't regularly check email because that's the nature of the work that they do. They're not tied to a BlackBerry the way that doctors and lawyers and, a lot of professionals are. So for that particular group, and I know we're not talking about warehouse workers today, but for that group, I said, we're going to send letters. It's going to say, you are recalled effective X date. If we do not hear from you by 3 days prior to that date, we will assume you have voluntarily resigned your employment. And then we're going to place a follow-up call to the person and leave a voicemail. In the state of Delaware and in most states, mail that is properly addressed is presumed to be received. And that's also for purposes of unemployment. So if an employee says, well, I never got the letter. So you never got the letter that I sent to your home address and you never got the voicemail that I left you. At that point, the state is going to say that's really on the employee.
Mm-hmm.
If you have company email addresses, then you can blast the entire company with the recall letter or the recall email and make clear that they have to respond to you by a specific date. If they don't, we will assume that you have resigned your employment. Very, very important in that communication, whether it is sent by fax or U.S. Postal Service or email or carrier pigeon, however we send it, it should be clear that we will continue to accommodate people. We'll grant leave, right? So you are recalled X date. If we don't hear from you before that time, we will assume that you have voluntarily resigned. If you are unable to return for any reason, contact HR immediately, provide an email and a phone number. And that is going to give you the coverage that you need so that you can safely remove anybody from the payroll who doesn't return.
Okay. Okay. How about let's see, I've been reading a lot about coverage about businesses facing wrongful death lawsuits from employees who die from
Mm-hmm.
COVID-19. Is this something my business needs to be concerned about? That's interesting in
So,
healthcare, of course,
yeah.
Mm-hmm.
You guys tend to deal with a whole different type of wrongful death lawsuit.
Mm-hmm.
What we're seeing, and the group that's getting a lot of attention particularly, are in the meat processing fields. And, we had some issues with a lot of businesses being late adopters of these protective measures, social distancing, and the use of PPE and mandatory leave policies if an employee was symptomatic in any way. And that has led to lawsuits. Walmart was also sued recently. But if you're doing the things that we talked about, if you are following CDC guidelines, there really should be very little reason to worry. What we are seeing in those lawsuits, the allegations, are that the employers completely failed to take the protective measures they were supposed to be taking. And that's why they got sued. So if you're taking protective measures, if you're doing what you're supposed to be doing, you should be okay, but always err on the side of excluding employees who might be sick, who are worried about exposure. It is better to keep them out of the workplace and send people home than to run the risk that they might be exposing other individuals in the workplace.
Okay. And let's go ahead and take just one more question right now.
Mm-hmm.
My state's unemployment commission is very employee friendly. Are they really going to take an employee off of unemployment when I try to recall them for work?
Yeah. So it's hard to make any broad statements about what's happening with unemployment right now. We are in an extremely unusual situation. Unemployment is generally designed to be just enough so that employees can get by until they find another job. And most states cap your unemployment benefits at something like 2/3 of your regular weekly wages before you lost your job. Right now, we have a situation where a lot of employees are making way more money on unemployment than they did when they were working full time. Say what you will about what that means for the pay scales in the United States, it is still the reality that we're living with right now. And we are seeing, a really big difference state to state in how they're managing those situations. And no surprise, it has some political implications, right? Red states are being a little bit more aggressive in removing people from the unemployment rolls. Blue states are being a little bit more lenient. But the reality is that if an employee refuses to return to work just because the benefits package is more generous, most states are, in fact, removing them from unemployment because that's not the purpose of these benefits. Other states are dealing very differently with these other issues of, well, I'm afraid to return because my elderly mother lives with me. I'm afraid to return because I've got a medically fragile child. That stuff is very much up in the air. But the blatant, I'm not coming back because I'm making $1,000 a month or a week on unemployment, those people are losing their benefits, yes.
Right. Okay, well, thank you so much, Lauren. Do you have any other words of advice or anything you'd like for us to think about that, any other words, any other stuff that you have on your mind?
Yeah, a lot of stuff on my mind, but not much of it relevant to this. I would say that the biggest takeaway for all employers right now is that the guidance we are receiving changes virtually daily. So make sure that you're regularly visiting the CDC's website, regularly visiting the U.S. Department of Labor's website, maintaining contact with your state legislature, your governor's office, and really staying up to date on the guidance from all levels of government because it is changing so rapidly.
Yes, that is great advice. That is so true. It does change so constantly, so rapidly. So thank you so much, and thanks for providing us with this information. Appreciate it. So
My pleasure.
yes, thank you. Attendees, please use the contact information on the screen for any further questions. Also, if you send us any questions, we'll forward them on to Lauren. Please remember your PAYCOM and PMI CEU certificate will be emailed to you from within 2 days following the broadcast. There's no need to request it. You can also register for any future webinars or request a demo of our compliance solution on our website at firsthcc.com or call us at 888-543-4778. And thank you for joining us.